Placebos. Placebos are fake therapies that can induce real therapeutic effects called placebo effects. It is not the fake treatment itself, but rather the complete therapeutic ritual that is carried out. This ritual is capable of triggering psychobiological mechanisms in the patient's brain. Both laypersons and scientists reluctantly accept this phenomena. After all, why not when it seems that fiction-induced clinical improvements are at odds with common sense?
It's a scamathon.
However, placebo effects are not really surprising. Such fiction-induced physiological effects occur in everyday life, and movies provide one of the best examples of how fictitious reality can induce psychological and physiological responses.
Surprise, motherfucker.
Before we go any further though, like, share and subscribe to this channel for weekly bites of random content straight into your YouTube feed.
Oh, mama.
A placebo's therapeutic ritual is made of many things, such as words, symbols, and meanings. These in turn induce positive expectations in the patient. If the outcome goes in the opposite direction, the effects are referred to as nocebo effects, whose main mechanisms are attributable to negative expectations. Now, how is it possible that a fake treatment leads to clinical betterment? This question is central to neuroscience, psychology, and medicine. It is also at odds with common sense both for the layperson and for the scientists. However, placebo-induced physiological changes and clinical improvements are not so surprising, after all, if considered within a more general context of people's daily lives. It has long been known that movies are powerful triggers of strong emotional responses, from love and tears to heartache and fear. These emotional reactions take place despite the fact that the viewer is aware that everything is fiction. Horror and thriller movies present fake victims, fake knives, and fake blood, and through romantic and comedy movies, we fall in love, cry, and laugh. The crucial point here is that the viewer knows all these to not be real, but still show powerful emotions and behavioral responses, just like in placebo treatments. From human evolution point of view, this is quite surprising, as these reactions are supposed to have evolved for social interaction and survival. The fact that they take place during movie where neither social interaction nor survival is at stake shows that emotional and behavioral responses can be provoked unconsciously or automatically. The changes that are produced in movies range from automatic activation to emotional distress and from cognition to behavior. These changes are also associated with changes in brain activity. For example, blood-curdling movies can also affect various blood functions such as coagulation and blood flow. The study of placebo effects involve many mechanisms. It has now been demonstrated that words on the one hand and drugs on the other hand may affect similar regions in the patient's brain, for example, when it comes to pain. But what is interesting is the recent idea that deception is not a necessary condition for inducing placebo effects. Now, within placebo treatments, there are two: open-label treatments or closed-label treatments. Open-label placebo treatments are those where the patient knows that the treatment is fake. Closed-label placebo treatments are those where there is deception as to the fakeness of the treatment. In open-label placebos, patients are told that this is a fake treatment and there is no deception. More importantly, the patients have no expectation of a therapeutic benefit. And it turns out, expectation of benefit is not always crucial in such responsiveness.
Surprise, motherfucker.
For example, in an experiment, a painkiller was given to the patients several days in a row, and then the painkiller was replaced with a placebo described as an antibiotic. Even though the patient expected an antibiotic, their pain was reduced, probably because the ritual of the placebo's administration mimicked, unconsciously, the ritual of the painkiller's administration. Clearly, expectations are not crucial in some instances. The mere ritual of an injection may produce an effect, regardless of whether or not the effect is expected. Positive effects of open-label placebos have been shown for a variety of conditions, such as irritable bowel syndrome, depression, pain, itch, and fatigue caused by cancer. Within the context of human and animal evolution, both are particularly sensitive and responsive to all those rituals that are important for everyday life, from social interactions to survival. Any ritual, situation, or circumstance that is important for life can potentially affect human and animal behavior, even though it is perceived as fake. In this sense, the similarity of placebos and movies' ability to induce psychobiological effects appears to be straightforward. But what exactly do these automatic association between rituals and psychobiological effects mean? The response is well explained by a very simple act, that of cutting and squeezing a lemon. This ritual is so powerful that viewing a film showing a lemon being cut and squeezed is associated with the sour and harsh taste of the lemon juice, and even induces a salivary response. It induces a salivary response even though the viewer is perfectly aware that the lemon will not touch his or her tongue. Similarly, the sight of syringes and pills triggers the release of a variety of chemicals in the patient's brain and are responsible for a number of placebo effects. Placebos and movies share many features, particularly if one considers open-label placebos. Seeing a syringe and knowing there is water inside is analogous to watching a horror movie and being aware that the knives are made of plastic and the blood is tomato juice. The real situation is not necessary. A simulation is enough to induce a similar psychophysiological reactions. Therefore, if placebo effects are viewed in a broader context of everyday life and behavior, they can be accepted even though they challenge common sense. However, there is one difference when it comes to movies and in therapy. In movies, fear and other emotions need not be a necessary response, nor do they have an apparent advantage. There is no real benefit to being scared or to salivating when one merely watches a video or a movie. In contrast, placebo effects can be advantageous. For example, there is an advantage for people whose pain is shut down by the mere social and empathetic interaction with the therapist. Many patients are very sensitive to words, stories, and rituals, and placebo effects could be enhanced whenever the psychological component of a disease plays a crucial role. The main claim of research on placebo effect is that any word, story, or a ritual inducing positive expectations and psychophysiological changes in the patient is acceptable because it can activate the same biochemical pathways and neural networks that have been identified through hard science. This paradox raises many ethical questions. Although a definitive solution to these ethical issues will surely be difficult to find, two things are very clear. One, that placebos do not cure but may sometimes improve quality of life. Hard science has shown that placebos can reduce symptoms like pain and muscle rigidity in Parkinson's disease, yet the progression of the disease is not affected. Neurons keep degenerating even though some symptoms can be reduced for a short time. Second, and related to the first, is that pain and anxiety are different from the disease itself. While placebos cannot stop cancer growth, the psychological component of some illnesses can indeed be modulated by placebos. So, where necessary and appropriate, placebos, words, stories, and rituals must be delivered by experienced health professionals. They do have real benefits. So what can we take from this? Placebo effects need not be seen as weird and bizarre phenomena at odds with common sense. They exist in many real-life instances, like in movies. 2. Sometimes the simulation of reality, as occurs in movies, is sufficient to trigger physiological reactions. This happens in the same way the simulation of a therapy as occurs with placebos. These are enough to trigger therapeutic effects. 3. The placebo phenomena still remains a paradox and an effect not easy to handle. But there are real benefits, and a broader understanding of them could help us avail these benefits at a larger scale. That's it for today. Thank you and take care.